Hello and welcome to the Economic Times Consumer Freedom Series. I am Rini Simon Khanna, and together with the country's largest media conglomerate, the Times Group, I am happy to host a series of conversations for consumer freedom with the intent of not limiting consumer choices, but protecting the consumer in a largely digital era of merchandising. Our platform attempts to impress upon decision makers the need to stop, ponder, and take a long-term view of the social and economic impacts of legislations that look to just ban and not regulate different products in the free market. As you're aware, around us, risky health behaviors run rampant. For those who indulge in various forms of substance consumption, how can we enable them to make the switch to less harmful alternatives? India has the world's second largest smoking population. And against this background, the government really needs to rethink the negative impact of bans on public health, increased instances of illicit trade with a flourishing grey market, and the urgent need to provide consumers opportunities to switch to better alternatives. In 2019, the Indian government announced a complete ban on all electronic smoke-free options, including manufacture, import, sale, and advertising of electronic smokeless products. You will agree that bans are the worst form of regulation and have historically proven to be ineffective, as seen across various industries. The current pandemic provides many learnings in terms of evolution of science and its impact on the implementation of public health policies. Similarly, as science around tobacco harm reduction evolves, public health policies and cessation strategies need to advance, keeping pace with it. As a society, we need to follow science rather than dogmatism. By investing in research and science and defining regulations which are progressive, as well as those that benefit all stakeholders. You'll all agree that it's a complex situation and deserves to be approached with a 360-degree perspective. Our discussion today will touch upon various aspects of harm reduction practice and the offer of alternative products as choices. And fortunately today, I'm joined by a pair of subject matter experts to help me do just that. Allow me to introduce them now to you. We have with us Samrat Chaudhary, Director, Association of Vapers India, and the past president of International Network of Nicotine Consumer Organizations, INCO, that represents 40 national consumer organizations working on THR. Samrat was a journalist for about 2 decades before he gave that up and founded the Council for Harm Reduced Alternatives and led the consumer movement for lower risk alternatives in the country. Welcome, Samrat, to our discussion.
Thank you.
We also have Michael Landl, Director, World Vapers Alliance. Michael is based in Vienna and is an experienced policy professional and, I believe, a passionate vapor. Welcome, Michael.
Thank you so much for having me.
If I could begin with you, Michael, harm reduction refers to the policies, the programs, and the practices that aim to minimize negative societal impacts associated with addictions. For the benefit of our viewers, could you please elaborate a bit more on what this means?
Harm reduction in general means to put practical solutions and methods which work in real life first. So in our case, when we talk about smoking, we all know it's very hard for most people to quit smoking. It's about 97% of people who try to quit fail without any help. So if we look at it from a general public health perspective, the best and optimal outcome would be if all smokers would just quit smoking. But we don't live in a dream world, so for most people that is just not possible to quit without any help. And then harm reduction comes into play, and we need to have solutions that work. And for us as World Vapers Alliance, obviously vaping is one of these solutions. It's 95% less harmful, and it's proven that it is a working and very effective smoking cessation method. We know that from studies, but we see it also in real life that millions of people around the world already quit smoking thanks to vaping. And obviously it's not optimal. Complete abstinence would be the best thing, but as I said, it's 95% less harmful. So if people switch from smoking to vaping, it's way better than if they would just keep smoking or trying to quit, come back. And overall, harm is reduced the more people switch from smoking to the less harmful alternative, vaping. But obviously, there are many other options as well. But from a general public health perspective, it's way better to get people off the proven and very deadly substance to a way less harmful substance. And I think that is harm reduction, should be the harm reduction strategy for every country.
Right. Samrat, could you share with us what are some of the leading challenges that consumers struggling with addiction face today in the context of determining whether to quit cold turkey or to find a safer alternative, as Michael was mentioning?
Thank you, Renee. I guess the challenges vary depending on which country or region you are in. But one global theme that I can identify is that there is acute lack of fact-based, accurate information which can help consumers make informed choices. This is especially true among tobacco users who are often offered unscientific advice. And, in India, for example, we have a lot of homemade remedies which are offered, which are not really that effective. And for example, a lot of tobacco users are told that nicotine is the enemy, which it isn't. The main harm is actually coming from the way the nicotine is delivered or the delivery mechanism. I also see a lot of misunderstanding about tobacco dependence. It's not framed in terms of addiction, but as a choice, and a bad one. And smokers are told that perhaps you can quit on your own and cold turkey is the way to go. But stats show that 95% of people who try on their own fail to quit. It may work for some smokers who have recently picked up the habit or are occasional smokers, but for a vast majority of people who smoke or are dependent on smoking, they would be better advised to seek pharmacological support through gums or patches, or seek counseling, or then substitute through other safer alternatives.
Are these patches and gums and other devices or products available for say consumers in India?
Well, see, gums and patches,
or maybe I should say easily available.
Yes, so that is I think the key point. While gums and patches are available, they are unaffordable to a majority of tobacco users. Not even cigarette smokers can afford them, leave alone Kenny and BD users. And counseling, for example, is almost non-existent. In-person counseling, on telephone it's one thing, but you have to meet because it is addiction, right? So yeah, it is based on a lot of individual, social, psychological factors which need to be addressed for you to come out of it. And and NRT support, for example, is quite expensive. Electronic cigarettes, as you mentioned earlier, are banned, and snus, which can be a great alternative for smokeless tobacco users, is also not available in the country. So while there may seem like a wide variety of options that smokers have or tobacco users have in general, very few of them are actually effective and proven effective in that sense.
Right, Michael. I mean, Samrat has kind of given you the picture of what it is like practically in a country like, say, India. When it comes to replacement therapy and other harm reduction approaches, what sort of risk reduction strategies have proven strategically effective in your view?
I mean, generally, we can quite clearly see the countries who are open towards innovation and alternative products are the most successful countries when it comes to reducing smoking rates. And I mean, that is quite clear because people are different. So every smoker is different as well. It needs different solutions to get rid of smoking or helping him to quit smoking. we already heard a couple of different alternatives which are out there, but I think this also shows why vaping is so effective and why vaping works, because every individual can individualize its own vaping experience. We have different flavors, we have different nicotine levels, we have different machines, delivery machines. So it's very individualizable. And I think we forget that this one size fits all solution, we ban something and then nobody will use it anymore, that just doesn't work. So we need to be open for different alternatives and innovation, and to have as much choice as possible for consumers. And from a policy perspective, I think it is very important to have a good regulatory framework for those kind of things. And what I mean with good is that we look at each individual product according to its risk and then find a proper regulation for it. We know vaping is less harmful as smoking, snus is way less harmful as smoking, nicotine pouches are less harmful than smoking. So obviously we can't treat them the same, or shouldn't treat them the same, because, for example, if we have the same tax on cigarettes and on vaping, there is no incentive for a smoker to switch, or vice versa. The incentive is not there. So we need to have a good policy regulatory framework for all these products according to their risks. And I think the good thing is there are some best case scenarios or examples out there in the world already. If we look at the UK, I think they are the leader when it comes to harm reduction policies in the field of tobacco. And they are very open towards vaping right from the beginning. And if we look at their smoking rates, they got slashed basically from the point on when vaping became popular. So it's not rocket science. It's the statistics already show it. If a country is open towards alternatives, the smoking rates decline, because every smoker knows smoking is harmful, and most of them want to quit but fail to quit. So we need to give them as many options, as much choice as possible to quit smoking.
Yeah, thank you for that. But I'm wondering whether is it just enough to have safer alternatives, or should there also be cheaper alternatives?
Yes, I mean, that's what I meant with regulation according to its risk. Obviously, if smoking is the most risk way to consume nicotine, I would call it, the tax should be higher on smoking than on vaping, and on vaping as low as possible, because this is one incentive. Price is always an incentive. Price can be an incentive to switch, plus additionally, obviously, the health benefits you get when you quit smoking. So we need to have as many of these incentives for current smokers to switch. Obviously, information is a very important part. I'm sure we talk about this later. But we need to educate the public, policymakers, decision makers, and especially smokers about the relative risk differences of these products, to give them as many incentives to switch to other alternatives.
Right, thank you. Before I go on to ask my next question, perhaps I should share with our audience that in September 2019, the Indian government announced a complete ban on e-cigarettes under the guise of preventing potential health risks to India's youth. This ruling was passed as an ordinance without debate or deliberation in the parliament, and mostly by ignoring both evidence regarding health risks and lessons from India's multiple previous disastrous experiences with bans. So in this context, Samrat, do you think safer alternatives are generally plagued by inadequate or ineffective policies? And what role can positive regulations play in enabling consumers to benefit from these safer alternatives?
So as a simple rule, products which are less harmful should have priority over more harmful ones. But strangely, this is not what is happening with nicotine products currently. As the most harmful products such as bidis, keni, and gutka in India, along with cigarettes, are the cheapest and most widely available, while safer alternatives such as e-cigarettes are banned
But Samrat, I mean, isn't this the case even with food? I mean, organic food products are higher priced than chemically treated or pesticide infested.
Sure, and that therein lies the problem. That uh, the policy guidance should be such, or incentivization of industry should be such that we are doing this for vehicle industry, for example. Cheaper,
Correct.
greener cars are being incentivized. We are incentivizing renewable energy. So it's not that the need is not felt, but what happens is perhaps because monitoring structures are already laid out for existing products, and making a switch or letting new products in would require devising, because these are much unlike cigarettes, right? Because they're analogous and these are electronic devices, but it is a tech innovation which can potentially save a lot of lives. So there should be policy investment into these products to understand. And it is not that other countries have not regulated them. There are more than, I mean, now the entire West has regulated these products. There are a number of regulatory mechanisms to pick and choose from, and pick elements from and see what works best for India within our current framework. So it is possible to do it. It's just that it requires political will and some sensitivity to how harm reduction can help tobacco users.
But I mean, when you talked about all this technology being, also lighter on the purse, as it were, electronic versus analog. I'm trying to figure out whether there is enough information out there, because countries like the UK or the US have got information out available for their consumers. Largely, people in India do not have information. So you have a lot of misconceptions. You will treat a smoker as an addict. You will not treat the smoker as someone who's exercising his choice. So don't you think we need to work a little bit more on demystifying and bunking those myths about all these thoughts that come into your mind, that when you watch a smoker, you're only looking at one way to sort that person out, by saying either you quit cold turkey or there is no other way out for you.
Sure, see, that quit and die approach is what is causing a lot of problems, because like you said, tobacco users.
So I mean, I'm saying, does one have to work on the mindset?
Certainly, a lot of awareness is required. A lot of countries are doing the right thing. For example, UK, as Michael pointed out, is doing a lot in actively promoting harm awareness, harm reduction awareness, by telling or letting tobacco users or smokers know that there are safer alternatives available. Now, the first option is that you should try to, but if you are not being able to quit, or you are in that category which does not, which enjoys recreational nicotine and is ready to take the risks, the ensuing risks, then at least engage with it in ways that are least harmful to you. And then devise policies which incentivize that choice. But if you remove that choice away, what you're doing is in effect perpetuating harmful use of products.
Correct.
So because
Correct.
by banning e-cigarettes, you are ensuring that anyone who is engaging with nicotine is doing it in the most harmful way possible. And that's not helping anyone.
Right. So, Michael, regardless of what science tells us, safer alternatives are not always viewed as life-saving inventions. In many scenarios, they're considered to be far more dangerous than, say, cigarettes themselves. What's the solution for this misinformation campaign? How do we tackle this?
I mean, that is a very, very tough challenge we face, because we all know there are very powerful anti-vaping organizations out there and spreading those kind of myths. And I mean, even in the US, we see the results. I think almost 60% of adults believe that nicotine is the substance which makes cigarette causing cancer. It's completely wrong. Even the NHS in the UK has that on their first page on their website, that it is not true. But we repeatedly hear those kind of myths, or if it's about flavors or the gateway effect, it's all disproven, but we still keep hearing it. And I think it's a big challenge to push back on that. And I think the only option is to have more and more events like this right now, but also that consumers and experts raise their voices wherever they can. If it's online, if it's contacting politicians, representatives, telling our own personal stories is, I think, the most powerful thing. And obviously, we also need education. So what we try to do from World Vapers Alliance perspective to put together all the papers and scientific expertise and write it up in a way that it's easily understandable. So we publish papers about general vaping myths, the flavor bans and why they are bad, or about nicotine, and then try to get those kind of messages also in the media. Unfortunately, in media, most of the times, the scary headlines are way easier to get into it. And vapers produce positive stories. And it's a general problem, I think, with media that bad stories, scary stories are reported way more than the good stories. And vaping is such a good story, and it's so unfortunate that it's so hard for us to get into it. But so I think everyone needs to play his own small part, raise our voices wherever we can, speak out against those myths. As consumers, obviously join consumer organizations like the two of us, for example. I think then we can push back, and you can see it a little bit if you look, for example, on Twitter. There you can see all those different vaping stories out there. Everyone tries to debunk as much of this wrong stories as possible, but it is a tough challenge because we have, as I said, very powerful enemies.
Hold that thought, Michael. I'll come back to you. I just quickly go to Samrat to ask him. India has 300 million tobacco users, and the government's goal is to reduce tobacco usage by almost 30% by 2030. How likely is this to happen? I mean, in the absence of a widespread harm reduction awareness, campaign going on, how is this possible?
Well, a recent WHO report stated that India is likely to achieve its 25 reduction target by 2025. Now, this is welcome. This is really welcome news. But I find it difficult to reconcile, this projection with on-ground facts and figures which show that more underage kids are using tobacco products. The Cancer Registry, the National Cancer Registry, is projecting that tobacco-related cancers are rising and will continue to rise. And also the fact that tobacco production or farming has in fact expanded or increased. So I don't think one policy measure is going to work. There is a lot of focus on increasing taxes on tobacco products, but these actions come with consequences that the consumers are then forced to either switch to cheaper products or buy smuggled goods, which ends up actually increasing population level harm. Same goes for no smoking zone policies or anything which is coercing a change in behavior. Now, risk reduction works really well, in this, especially in case of addiction behaviors, because it gives the tobacco user or the consumer agency to make an informed, safer choice. It takes away the burden from the state machinery to make that change happen and gives it in the hands of the users. Because see, it is not that tobacco users don't know that the habit is risky. They do. They are looking for alternatives. Studies upon studies are showing that tobacco users, if given a choice, would make a switch to something less harmful. And this is true for all of us in our regular habits. Given a safer choice, we would take that if it was affordable and accessible. Also, in India, there is the additional problem that we have is that we have weak enforcement and also poor or no cessation support. So harm reduction or giving users the agency to make safer choices is even more vital. So I think we can achieve targets. Also keep in mind that as we keep going lower down, like 30 to 25 is possible, 25 to 20 becomes even more difficult. So, these top level measures of, higher taxes will stop working after a point, or in fact have serious unintended consequences. So we need to start looking at harm reduction right now.
Right. So as a voice of the industry, how are you working with the various stakeholders to raise awareness about the negative impact of this ban and the impact of India's healthcare industry?
Is that question to me?
Yes, Samrat.
Well, I think you have it wrong. I am not the voice of industry. We represent consumers and we are the consumer voice. While we are sympathetic or we have a practical understanding of how this can work, we are not the industry. We are not funded or in fact, there are a lot of views or positions that we take which are anti-industry. What we are concerned is with the consumer choice, that consumers in India, tobacco users, there are 27 crore tobacco users in the country, should have access to safer alternatives and should have a large number of options, the ones which work, to choose from while they are on the quit journey.
Right. I mean, what I meant was that you are the voice for the people who are trying to quit and trying to make a safer choice, and work. So, how are you bringing those varied forces, the forces at variance with each other, to come together to understand that harm reduction philosophy has to be critical towards achieving mass adoption?
See, at its core, it's a human rights issue because a tobacco user is facing a serious set of consequences if they walk down, if they continue tobacco use. I mean, more than half of people who use tobacco or smoke over long term are going to die from it. So so it is a vulnerable group. Also keep in mind that in India, tobacco use is largely prevalent in lower economic groups. So these are also people who have less means to deal with the consequences of tobacco use. So there is an urgent need to address the health issues faced by this population. Now, one way to do that is, of course, awareness campaigns, make them more aware of less harmful alternatives being available, while at the same time incentivizing industry. We didn't ask the vehicle industry to vanish because we wanted greener cars. What we did was we incentivized them to produce greener cars or less polluting cars. And we can do that with the nicotine industry or the tobacco industry and incentivize them to produce less harmful goods. And that can be done at the policy level. So I think it is a coming together of a number of stakeholders, the policy, the lawmakers, public health organizations, the industry, and consumers. And it is happening in other countries. So it is not that it's not been done before.
Right. Thank you so much, Samrat. Michael, as a build-up to COP9, there were about 100 international specialists representing nicotine science, policy, and practice who came together to call on 182 countries to the Framework Convention on Tobacco Control to take a more positive stance on tobacco harm reduction. In an open letter, the experts countered WHO's dogmatic views, resulting in prohibition and excessive regulation of heated and smokeless tobacco products. What are your views on this?
Yeah, this initiative was great and very, very helpful, but unfortunately, we saw that the WHO still ignored the experts, but also the consumers. So I think it is time that politicians around the world stop ignoring science and consumers, because science is quite clear on the issue. Vaping is less harmful, other alternatives are less harmful, and they are successful in helping people to quit. And we have millions of consumers who are not anecdotes. This is evidence as well that it works. But unfortunately, politicians, but also bureaucrats in the WHO, they ignored science and consumers for way too long. So I think it is time that consumers and the experts speak up, raise their voices. And this initiative, therefore, was very well. And I think organizations like ours, this is exactly our goal, what we try to do for consumers as well, to bridge the gap between decision makers and the consumers and help the consumers to reach the decision makers and tell them about their own personal stories. Because I think this is the most powerful thing we have, because for a politician, it's hard to ignore a person who is telling them, oh, I smoked for 50 years. I tried to quit 10, 20 times and always failed till I got a nicotine pouch or a vaping device in my hand. And finally, I could get rid of smoking. That is hard to ignore. And I think we need to have more of this positive stories, because the WHO is probably a different issue, but most politicians, they are not hardcore anti-vapers. They just are not educated enough. They don't know what it is. They don't know how it works. And I think we need to bridge this gap between the consumers and the decision makers as fast as possible, because then in the long run, I think science will win and harm reduction will be implemented. The question is how long it will take and how many backlashes we will have in between. And
would you be able to share with us what are the countries that have set the benchmark when it comes to creating sustainable and scalable harm reduction frameworks?
I mean, the number one country we look always at is the United Kingdom. They are very progressive and open about vaping, and the numbers show it. And I think, for example, a fair comparison would be UK and Australia. UK, one of the most open countries when it comes to vaping, and Australia, one of the strictest one. They also have a ban. And when you compare the smoking rates since 2013, when vaping became popular, the UK slashed its own rate by 25%, while Australia only reduced it by 8%. Obviously, vaping plays a role in that nobody can deny that. And I think more countries should look at the positive examples, like the UK. We have others, New Zealand, France as well, and try to adopt their policy framework according to those, and stop listening to Bloomberg and start listening to science.
Right. It's interesting that you mentioned the UK. I mean, I know that the United States and the UK have taken two contrasting approaches to ENDS, or electronic nicotine delivery systems, and they've produced significantly different results. The UK, on the one hand, as you mentioned, has encouraged the use of ENDS as an alternative to far more dangerous traditional cigarettes. And there are many examples of countries that have successfully regulated reduced harm products. We, I think, would like to urge governments to rethink their stance by regulating it clinically, medically, or legally, not leaving it to the free market, and feel that banning products is the worst form of regulation and should be avoided if possible. India's current policy framework misses a huge opportunity to address the problem of cigarette smoking, considered to many by many to be the leading preventable death or cause of death and disease within the country. This also goes against the growing body of science that points to these products being significantly less harmful than cigarette smoking. Thank you so much, Michael and Samrat, for joining us today and for being completely honest and candid in your responses. To all of you, thank you for watching, and do join us again as we bring to you interesting conversations on consumer freedom.